ERs are overloaded with people who shouldn't be there, and having universal healthcare wouldn't automatically fix these issues. The thing is that here the ER is typically the only place that people have to receive healthcare at all. Most people don't have a PCP. And why don't most people have a PCP? Because under a for-profit medical model, it's not profitable to prevent diseases. I would counter that having universal healthcare would drastically decrease ER volume and ER workload overall, because the ER right now is the only safety net we have at all for people to receive healthcare to get any of their needs addressed. And while there are individual examples of health insurance plans providing yearly screenings and things like that, when you look at the zoom out for the big picture of American healthcare in the United States specifically, the only things that really make money is billing for surgical services. And when you combine for-profit medicine with late-stage capitalism and people not being able to access or have time to even go in to see a primary care provider, the can gets kicked down the road, patients are sicker than ever, and then they come into the ER when they have an acute exacerbation of chronic issues that could have been prevented had they just had livable working conditions and access to healthcare. As a piece that ties into that, we make it extremely unattractive for physicians and other providers in training to go into primary healthcare whatsoever, because insurance companies dictate the care that patients can receive. So if you work in primary care, more than half of your time is spent arguing with an insurance agency about whether or not a patient can actually receive the care that you went to school for years to decide about whether the patient should be able to receive or not. So on both ends of the equation, we have people being de-incentivized from going into primary care, because who wants to work at a place where you're arguing with an insurance company all the time? You're playing whack-a-mole trying to prevent all of these acute outcomes. And then for patients, there's not enough providers who are available, so you can't even get in to go see a primary care provider. And if you do, it's expensive. So what do? You end up in the ER. For-profit healthcare is an absolute sham, and it's a system that doesn't work. Point blank period, for-profit healthcare doesn't work. And before you compare our healthcare system in the United States to Canada, Canada is also actively moving to try to privatize their healthcare system, and they're underfunding the system, which makes it intentionally shitty, so that investors can sweep in and privatize it and make a fuck ton of money. So you shouldn't compare US healthcare to Canadian healthcare. And even Canadian healthcare, at least, is not going to bankrupt you to go to the ER.